Where does ependymoma usually form in the brain? Ependymomas are a type of tumor that originates from ependymal cells. These cells line the ventricles, which are fluid-filled spaces in the brain, and the central canal of the spinal cord. Ependymomas can develop anywhere within the central nervous system, which includes both the brain and spinal cord. However, their typical locations often depend on the age of the patient and the specific subtype of the tumor. In children, ependymomas are most frequently found in the posterior fossa. This area is located at the lower back part of the brain, near the middle of the back of the head. The posterior fossa includes important structures like the cerebellum, which is responsible for movement, balance, and posture, as well as the brain stem, which controls vital functions such as breathing and heart rate. In pediatric cases, posterior fossa ependymomas are the most common form of this tumor. In adults, the situation changes somewhat. Ependymomas are more often located in the spinal cord, particularly along or near the central canal. While they can also occur in the brain, especially in the supratentorial region, which is the upper part of the brain that includes the cerebrum, this is less common compared to their occurrence in children. Overall, ependymomas tend to arise near or within the ventricular system of the brain. The fourth ventricle, located in the posterior fossa region, is a typical site for these tumors. Additionally, they can develop along the central canal of the spinal cord. In rare cases, ependymomas may form outside the central nervous system. Understanding where ependymomas form is crucial. The location of the tumor can significantly influence symptoms, treatment options, and overall prognosis. For instance, tumors in the posterior fossa can impact coordination and vital functions, while tumors in the spinal cord may lead to neurological deficits due to spinal cord compression. This distribution of ependymomas is consistent with established medical knowledge about brain cancer and brain health. If you have concerns about brain tumors or symptoms you may be experiencing, it is always best to consult with a healthcare professional for personalized advice and guidance.